Have you ever pondered over the legal framework of the medical termination of pregnancy in India? Well, let's journey back to the early 70s, when the Medical Termination of Pregnancy Act was first introduced in India in the year 1971, to be exact. This groundbreaking legislation outlined the conditions under which a pregnancy could be legally terminated in the country. It was a significant step forward, offering a legal avenue for women to exercise their reproductive rights while ensuring their safety and well-being. At the heart of the act was the intention to protect women from the risks and hardships of unsafe abortions. It established a legal framework that authorized only registered medical practitioners to perform abortions, thereby reducing the prevalence of clandestine and unsafe procedures. The Act also stipulated the gestation periods for legal abortion. Initially, it allowed for the termination of pregnancies up to 20 weeks under certain conditions. These conditions were carefully defined, taking into account various factors such as the health of the woman, the potential health of the unborn child, and cases of contraceptive failure among married couples. An essential component of the Act was the emphasis on informed consent. It stressed that the pregnant woman's consent was crucial before proceeding with the abortion, underlining respect for the woman's autonomy and decision-making power. Furthermore, the Act underscored the importance of confidentiality, advocating for the privacy rights of women undergoing abortion. It stressed that the details of the woman and the procedure should be kept confidential, further safeguarding the woman's rights and dignity. Thus, in 1971, India took a significant leap forward in women's healthcare. The introduction of the Medical Termination of Pregnancy Act was a pivotal moment in the history of reproductive rights in the country. It provided a legal framework that protected women's health, respected their rights, and acknowledged their autonomy. Thus began a new chapter in women's healthcare in India with the introduction of the Medical Termination of Pregnancy Act in 1971. Over the years, the Act has seen several amendments to address changing societal and medical needs. It's been a journey of evolution, reflecting the ever-changing landscape of reproductive health and rights. One of the most significant amendments to the Medical Termination of Pregnancy Act came in the year 2021, extending the permissible gestation period for abortions. Previously, the Act allowed for termination of pregnancies up to 20 weeks under specific conditions. However, recognizing the need for a more flexible approach, the amendment extended this period to 24 weeks in certain cases. This change was necessitated due to a range of compelling circumstances. For instance, there could be situations where the continuation of the pregnancy might pose a substantial risk to the mother's life or health. In other cases, there might be a significant risk of the child being born with physical or mental abnormalities. In such scenarios, the extension of the gestation period offers a vital lifeline, providing women with more choices and control over their reproductive health. But the Act didn't just stop at gestation periods. It also addressed the circumstances under which abortions can be performed. It recognized the need for abortion in cases where the pregnancy poses a risk to the life or physical or mental health of the woman. The law also takes into account situations where there is a substantial risk of the child being born with physical or mental abnormalities. Additionally, the Act also acknowledges cases of contraceptive failure among married couples, further broadening the circumstances under which an abortion can be legally performed. These amendments signify a pivotal shift towards a more comprehensive and nuanced understanding of women's reproductive rights. They reflect a commitment to acknowledging and addressing the diverse needs and challenges women may face in their reproductive journeys. The amendments have been instrumental in ensuring that the Act remains relevant and effective in safeguarding women's reproductive rights. They not only provide a legal framework, but also echo the voices of countless women affirming their rights and empowering them to make choices about their own bodies. Opening. The Act is precise about who can perform abortions, ensuring women's safety during the procedure. Diving into the details, the Medical Termination of Pregnancy Act in India is specific about the eligibility of healthcare providers. It stipulates that only registered medical practitioners can perform abortions, a clear mandate aimed at ensuring the safety and well-being of women. But what does it mean to be a registered medical practitioner? In the context of this act, a registered medical practitioner refers to someone who holds a recognized medical qualification as per the Indian Medical Council Act of 1956. They must also be registered in a state medical register, ensuring their professional credibility. However, not all registered medical practitioners are equal when it comes to their roles and responsibilities in providing abortion services. The Act differentiates between providers based on their experience and qualifications. For instance, a practitioner who has been registered for less than 5 years can only conduct abortions if the pregnancy is not beyond its 12th week. On the other hand, if the pregnancy has progressed beyond 12 weeks but is under 20 weeks, the procedure can be performed by a team of 2 registered medical practitioners. This duo must agree in good faith that the continuation of the pregnancy would risk the life of the woman or cause grave injury to her physical or mental health. The law thus delineates roles and responsibilities based on the level of expertise and experience of medical practitioners. This hierarchy in healthcare provision is designed to ensure the highest standards of care and safety for women seeking abortions. In conclusion, the Medical Termination of Pregnancy Act in India enforces stringent eligibility criteria for healthcare providers. It ensures that the sensitive and critical task of providing abortion services is placed in the hands of qualified, registered medical practitioners who have the requisite knowledge and experience. Closing. The Act ensures that only qualified and registered medical practitioners are entrusted with the responsibility of performing abortions. The Act stipulates certain conditions under which a pregnancy can be terminated. The Medical Termination of Pregnancy Act in India lays out a clear framework for when and how a pregnancy can be legally terminated. The conditions under which an abortion can be performed are diverse, and they reflect an understanding of the complexities and nuances involved in such decisions. One of the key provisions of the Act is that a pregnancy can be terminated if it poses a risk to the life of the woman. This risk could be physical, such as complications that threaten the woman's health or life. It could also be mental, acknowledging that the psychological strain of carrying a pregnancy to term can sometimes be too great. In addition to this, the Act also takes into account the potential life of the child. If there's a substantial risk that the child will be born with serious physical or mental abnormalities, an abortion can be legally performed. This provision reflects a compassionate view towards the potential suffering of the child and the parents. It's also important to note that the Act recognizes the reality of contraceptive failure. In cases where a married couple has used contraception but it has failed, leading to an unwanted pregnancy, the Act allows for the legal termination of the pregnancy. This provision highlights the importance of family planning and reproductive rights, giving individuals the power to make decisions about their own bodies and lives. It's essential to remember that these conditions are not arbitrary. They are based on a deep understanding of the various factors that might necessitate an abortion. They ensure that the woman's right to life and health are protected. They also ensure that the potential child's right to a life free from undue suffering is respected. The Act, therefore, provides a clear guideline for the conditions under which an abortion can be legally performed. The Act emphasizes 2 key principles: informed consent and confidentiality. Let's dive deeper into these 2 fundamental aspects of the Medical Termination of Pregnancy Act. The first principle we are focusing on is informed consent. This is an essential requirement before performing an abortion. But what does informed consent actually mean? Essentially, it means that the pregnant woman must be fully aware of the procedure, its risks, benefits, and alternatives before she gives her consent to go ahead with the termination of the pregnancy. It's about making sure that she's making an informed decision based on all the available information. This is not just a legal requirement, it's also an ethical one. It respects the autonomy of the individual, ensuring that they are not coerced or deceived into making a decision about their own body. It's about making sure that the decision to terminate a pregnancy is truly the woman's own decision, made freely and without pressure. The second principle emphasized by the Act is confidentiality. This is another crucial aspect of the law which underlines the need for maintaining the privacy of women undergoing abortion. Confidentiality is not just about ensuring that personal details are not disclosed without consent. It's also about providing a safe and supportive environment where women can seek help without fear of judgment or stigma. It's important to remember that a woman's decision to terminate her pregnancy is a deeply personal one, and it's her right to keep this information private if she chooses to do so. Healthcare providers are obliged by law to respect this right and protect the confidentiality of their patients. These principles, informed consent and confidentiality, are not just legal requirements. They are also ethical guidelines that ensure the respect and protection of women's rights. They are crucial in ensuring that the process of medical termination of pregnancy is carried out in a manner that respects the dignity, autonomy, and privacy of the woman involved. The Medical Termination of Pregnancy Act, therefore, not only regulates the procedure of abortion, but also safeguards the rights of women in the process.